As a nurse navigator, I do a bunch of different things. We really are there to support patients. My role here, as part of the heart failure clinic, my job is to help transition patients from the hospital to home and help them navigate that period of time when they've gotten home and things might be different or new, or they've been diagnosed with a new condition that might be scary for them. I'm their go-to person while they're home if they need anything.
Has Ben available?
In the heart failure clinic made it very easy for patients to get in touch with us while we're there so that they can share with us any concerns they might be having, any new symptoms they might be having. And also my favorite is sometimes they just call to catch up. It feels amazing to have a connection with my patients. It feels like I'm helping them not just work through whatever they have in terms of an illness, but also to be there for support emotionally and mentally. It helps with their overall wellness. I love connecting with people, not just patients, but their families. And I think it's important to be their support during some of their most vulnerable times, and that is extremely rewarding to me. Working at Wentworth-Douglass has, over the last 9 years, really built a family for me. I came from an outside facility as a new grad where it felt very large and kind of like a small fish in a big pond, and transitioning here to Wentworth-Douglass really helped grow me into the nurse that I am. It has that close-knit feel to it, which makes it extremely high functioning from a medical standpoint. Everybody's trying to make a difference here, and they're helping change patients' lives on a day-to-day basis. Being nominated for the President's Award is very special to me. I think that it recognizes not only the hard work that I've been doing, but also the work that my team has been doing, and the amount of work that we've been doing to reach our patients during this difficult year. I think for a lot of people, connecting with their healthcare team has been hard. So being that person to provide that connection through the last year has been extremely rewarding. When I go in today, I might make somebody else's day better. It might be that today they might not get the greatest news, or I might help them understand something better so it's less scary to them. I feel like I'm changing people's lives.
When I was a teenager, I found out my father had cancer. I always knew I wanted to be in the medical field. So when my father passed away, he passed away when I was 17. But that drew me to I really want to help people. There was no indecisiveness about that. I knew I wanted to help people. So I wanted to work in the hospital at some point, and I came across patient transporting. And I was like, I'll just give this a shot. This sounds interesting. I did track in high school. Endurance is there, We almost missed our stop. My name's Arielle Camillo, and I'm a patient transporter here at Wentworth-Douglass Hospital. I've been working here for about 5 years. And I will eventually be a nurse here. So that's super exciting as a new grad. So we start off with a call. That could be from just getting a patient from their room, bring them down to a testing site, or if they're in the emergency room setting, we would have to bring them to CAT scan, X-ray, and also we do emergency situation calls, so rapid responses, rapid response teams, stroke team activations. With codes, they need emergent care. We have to be there as fast as we can and just try to help them as much as we can as transporters. Planning it out in your head, maybe I need to go grab a stretcher first or a wheelchair. You just never know what the situation is, and just being prepared at all times for that. I was honored to be nominated for something like that. I was just in awe, and it just means, I feel like it just means that I'm doing something right. I love the environment, the staff in general at the hospital. Just everybody works together, and everybody's even though it's a hospital and there's a lot of sad times, but everybody is cheerful and just trying to make the best of a situation and just working together and making sure that the patients are taken care of. That's the #1 priority.
There's a screen that you select on the robot actually which procedure you're doing, and then it positions itself. And that's how Body by Dima is created. My name is Havaleshko. I'm a director of the Center for Weight Management and Bariatric Surgery at Wentworth-Douglass Hospital. as well as chair of robotic surgery here. I do wide variety of surgical treatment of obesity and cancers. It's not all about weight. People with diabetes, we send them home without diabetic medications after surgery. Once I started learning about robotic surgery, it was just like, no, that's what I want to be focusing on, because it's much better to operate with high definition 3D vision inside of the patient's belly. It's much better to have 4 arms to control than 2 arms. I wish, people were born with 4 arms. If somebody is trusting you to be inside of them, I think at that point it needs to be perfect. And that's what robotic platform, and especially Dmytro robotic platform, allows us as surgeons. We do not just drag people from the street into the surgical suite, do quick, perfect bypass or perfect sleeve or some revision and send them home, right? We do 4 months of medical pre-optimization, surgical optimization, and the Wentworth-Douglass allow us to do this perfection of the patient's health prior to doing surgeries. They know what to do, they know how to make right choices after that, and they know how to maintain their weight loss. So it's not just my nomination. I consider this as a recognition of our contribution to Wentworth-Douglass and to our patients. It's, as I said, so rewarding. I'm pretty happy every time you see these patients when they're walking around and so happy, and everyone wants to just show their progress and success. And it's just, every day we're just walking with our wide eyes and like, wow, wow, wow. Their life is back.
I understand that you're getting ready to have your knee done in a couple weeks. Is that true?
I am, but I'm a little nervous.
Okay, well that's going to be my job, to help you feel really comfortable. My name is Donna Smith. I'm the Joint Replacement Program Manager. I came here 42 years ago. I actually came from New Jersey, and I had worked in a big city hospital. So I really didn't even know what a community hospital was all about. Back in 2005, one of our orthopedic surgeons had this idea and had researched this idea and concept back in Florida. We were able to bring it back here at Wentworth-Douglass Hospital, and I've been a big part of the creation and the development, keeping it going and getting better and better. One of the things that we always tell a patient are the surgeons are great and they're going to give you a new knee or a new hip, but it's going to be a lot of work, it's a big journey, and it's going to be a lot for you to do. So you're going to have to now do the work.
This is the gym.
Patients typically have been in pain for so long, and it's really caused them not to be able to do anything. So once they do have this operation and they can get back to doing things and they see that they can, I've had many patients call me later and say, wow, 6 months down the road, I'm doing this, I'm doing that, and it was worth it. I wish I would have done it years ago. Do you feel like you were prepared for the surgery? How about your book? Do you have a knee book like this? Really takes a village is what I have found. It is such a big team, and it would not work unless everybody has embraced it as much as I have. We'll sometimes do around 400 patients a year.
We'll set up.
Yeah, we tell everybody they're getting up the day of surgery, and most of the time I'll get a face like, what? We're getting up that day, and we say early mobilization is key for great outcomes, and we get everybody up. Well, being nominated for the President's Award is such a great honor. I mean, I know it's recognized as such a prestigious award, and especially coming from my peers. Yeah, that's what's been getting pretty hard, because I am getting ready to retire. Just saying goodbye to so many people, because I have been here and I've seen so much growth and so much change throughout the years. But I think the values and the beliefs that we have here at the hospital have always stayed the same. I think we all go into healthcare wanting to make a difference and to impact people's lives and to do good. But I am looking forward to my new journey of getting retired and being able to spend some more time with my family.
So actually, Donna Smith, who is one of the other honorees for this award, hired me back in 2009, and I worked for her for a while before I went over to the pain clinic. went into nursing to stay primarily clinical, which is why I took the CPL position, because it allowed me to kind of stay primarily clinical with a little administrative. I will either work upstairs in our procedural area, just kind of getting patients prepped and ready for their procedures, and just monitoring them after and getting them home. And every once in a while I'll jump in the procedure rooms too and run procedures with staff. We treat patients in the pain clinic for acute and chronic pain. We do a lot of interventional spine procedures for patients with back pain, knee pain, joint pain. So really anything to try to help a patient kind of progress. Our chronic pain patients, I've seen them almost my whole career there. Some of these patients come in and out, so you really get to develop a rapport with them and really kind of get to know them.
They're going to take great care of you.
We're a small group of nurses that all work together in treating this patient population. So I think patients come in knowing that they're going to get good kind of care from us and quality care, and that they're well taken care of. And the physicians will say, what do you guys do differently upstairs? And I'm always just like, we're a great team together, and we want to like treat the patient and really work with them. We just kind of read the room is what we say. So, you get to work and everyone just kind of knows their role and their job and works together. I tend to like to fly under the radar a little bit and not be in the spotlight. So I think that I feel very honored that someone or my staff have thought that I've done a job well done. I love Wentworth-Douglass, and why I've been here for so long is really the culture in the community here. Even in the most trying of times that we've had recently, that they've really made a lot of efforts to make staff feel supported, and I don't think you necessarily see that in other places. My patients mean to me, they're giving me the ability to do something that I love. Patients, are why I have the job that I have, and I tell them that all the time when they're like, I can't believe I'm back. I hate that you're back, but we're here to help you, and so I wouldn't be able to do what I do without you. So I hope that, at some point in my career that I'm making a difference for them too.
We take care of patients with cancer and hematologic diseases, and we help diagnose, we help stage, we treat where appropriate, and then we follow them up afterwards. The team approach is what makes the Seacoast Cancer Center unique. It's not one person taking care of one patient, it's a team meeting the patient's needs and often helping with the family needs. I came here from Salt Lake City, where I did my training, and before that I was a New Yorker. When I graduated from medical school and decided to go into internal medicine, I wasn't sure if I wanted to be an internist or do a subspecialty. And at the end of my internal medicine training, I enjoyed it so much that I thought I want to keep training. The field I picked was oncology because I felt like it was one of the last frontiers, because there was so little happening in oncology and it was obvious things were going to be moving. The evolving treatments are what keeps me in practice because it's always stimulating and challenging. And the key thing in keeping current is reading, obviously, but also knowing how to network with people. The innovations have been exciting, and if we're not looking for innovations, we're not going to make any progress. I feel part of a community. I feel like I have a family at home and I have a family here, and so it's a nice place to work. So to be nominated for this award has been a true honor and makes me smile because it's been a lot of years of hard work, and I was thinking very seriously of retiring this year. And when the time came to make that final decision, I thought, well, even though my age says I can retire, I really don't want to retire because I enjoy the work here so much. I enjoy the hospital and the staff and the community. So, but it's nice after all these years of work to be known.
Well, I always wanted to be in medicine. I received my first microscope when I was 8 years old from my grandmother, who was also a laboratorian. The science is part of me. I wanted to go to medical school. My financial situation and life situation did not allow for that, but I feel like I've been able to make a difference without that medical degree, simply by helping to lead people through this pandemic. With the COVID-19 pandemic, My job has shifted to areas where I never thought they would.
So when we don't have any COVID patients, we don't have to keep the doors closed.
It has felt exceptionally rewarding to be trusted by my community, by my staff, and for the most part by the patients.
When you're gathered together, try to maintain that distance.
So learning to be in front of a television camera, whether it's Zoom or live, has been an incredible challenge for me, one that I believe I will never become comfortable with.
These vaccinated individuals can still possibly develop mild or even asymptomatic COVID-19 infection.
I felt that the messaging was so important and needed to be conveyed by someone with the knowledge, science, background to spread the right information, the accurate information and the safe information to our community, hopefully to undermine some of that mis and disinformation that was so pervasive and continues to be.
For every one person infected, 5 to 8 people around that person will also be infected.
The shifts that we've seen in the policies related to COVID-19 and others, if we didn't sit together as a team and look out towards the horizon with all the same focus, we would not have been able to achieve the safety and efficacy that we have. And we're starting to come out on the other side. And we're starting to open up and starting to see that we were able to shepherd our staff and our community through this horrible pandemic and get the brighter, longer days coming out on the other end, finally. I actually cried when I found out that I was nominated because it just is such a meaningful time for all of us. I sit and work beside 2,000 or 3,000 rock stars who are all, each and every one of them, worthy of this award. The care never stops, the caring never stops, and we're able to pivot whenever we need to make sure that that care continues.